Hello everybody, good evening. My name is Mr. Alan Matus again tonight. So we'll be having our Facebook Live on prioritization and delegation. So I hope that everybody's here tonight and we have exciting questions for you again, everybody. So without further ado, I would like to introduce myself. My name is Mr. Alan Matus and I am a nurse educator. I have been teaching students for more than 20 years, teaching nursing students and also teaching them on how to pass the NCLEX. Also, currently, I am a nursing faculty in a nursing college in Los Angeles. And also, I'm the president and founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. Also, I am an author that who has published my book, and you can find my book in Amazon. And the name of the book is Simple, Fast, and Easy NCLEX Review Book. Okay, so anyway, without further ado, everybody, I would like to give a shout out again to our students for tonight. So let's see who's here for tonight. Let's see some probably some new names that we have for tonight. So we have Kikil Barker, so shout out to you. Thank you very much for being here tonight. Also we have Regine Daria. So Regine Daria is our student right now in the online NCLEX Academy. Okay, we also have Eve White. I think Eve White is new tonight, so we haven't seen you here. So thank you for joining us, and I hope that you will enjoy our session for tonight. Okay, and then we also have, of course, some other students that we have before who are joining this program that we have. Okay, so but anyway, everybody, thank you very much for being here tonight. And we also have Daph Aquino de la Cruz. Nice to be here as well, so thank you very much for being here. So we'll go right away and proceed to our program. Okay, anyway, you can also indicate your rationales later on when you answer the questions that we have. Okay, so first we have, all right, so last week I told everyone that I'm sending out bookmarks to all students who sent me their address. So these are all the letters that I have done and the bookmarks, the dedication that I'm giving to the students, and I really enjoy doing this. Really, it's nice to inspire students, and of course, when you're preparing for the NCLEX, it's not only a physical preparation, but also it is a mental preparation. So you need that motivation, you need that positive attitude, and be inspired on your goal to pass the NCLEX. So I'm here to support you and to really give you inspiring words and motivational words so that you will keep on reviewing for your NCLEX. It's always trying to find the right resource for you, the right material that will work for you. That's a secret to NCLEX success as well. Always find what is the best material that you can use, and from a trusted resource, of course. Okay, so at this time, what's going to happen is that we are not sending anymore at this time, so we'll announce one of these days when are we going to send again this bookmarks to students. So we will let you know, guys, and then after that you can email us. So we only have limited numbers of bookmarks that we can send out in a month. So maybe next month another, or this month probably, or next month we'll have new batches again. So we'll announce that. So always be in our page, always join this Facebook Live so that you can receive these bookmarks, and in the front of these bookmarks are the laboratory values, so that when you're studying you can see the lab values. And we have other versions of the bookmark as well, and they're coming soon. So and I'm so overwhelmed with the number of students who have been so excited and really wanted to have this bookmark. Okay, so I'm sending them out soon, the ones who emailed us last week. So please don't send your address anymore at this time, because we will not be able to accommodate that. Okay, so just watch out this month or next month or anytime when we are sending out the bookmarks for free for all of you guys. Okay, so thank you very much. So all right, also I would like to find out where are you coming from, everyone? I would like to find out if you're in the US or are you in another country. You know, I want to find out your location, everybody, and what brought you here. You know, so I'm glad to to know if someone referred you or you found this through the website. Okay, so please let me know so that we could put that in the shout out as well. Okay, so Charisse. Okay, so Cherries, yes. Cherries, yes. I would like to find out from which country are you guys, okay? And of course, for tonight, we'll be announcing the winner before we end of the 90-day online access NCLEX review, the persons who joined last week, okay? So we will pick one winner and we will announce that before the end of the session. So last week, it was Kamel who won the 90-day online NCLEX review. So I hope that somebody will win tonight and this person really needs this program, okay? So let's see where you're coming from, everyone. So Miss Brar is from California. Okay. Also, we have Nisha. So Nisha is from India. So nice to welcome. Okay. Welcome, Nisha, for being here tonight. Okay. We also have Renali. So she found my Facebook Live by researching the NCLEX review. So thank you very much, Renali. Okay. So that's nice. And then also we have Pau Pau is from San Jose, California, and was referred by a friend. So thank you very much for that. And also remember this, that in our Facebook page, we have some of the recordings of this. Okay, some of the recordings, and the complete set of all of these recordings is found in our online NCLEX Academy. Okay, which you can access all the previous programs that we have. So you will have access to that. And once you're enrolled in the online NCLEX Academy, you also have access to all of the upcoming Facebook Live that we have, because we put them in the Academy. Okay, and always remember that in the NCLEX, you will never walk away from the NCLEX without questions on prioritization and delegation, okay? Because coordinated care or management of care is part of the test plan. It's already in the blueprint of the NCLEX that you will be tested on prioritization and delegation, okay? So we also have other students. We have from the Philippines, Melissa. So Melissa is from the Philippines. Welcome here tonight. Okay, nice to see you're here. Okay, and then we also have, for the first time, I guess, we have Sono Shrestha Agbide, and she's from Colorado. So nice. Okay, thank you very much for being here tonight as well. Okay, so that's it, everybody. So can you please write a big yes on the comment section, because we're about to have our first question for tonight. Okay, our first question, everybody. Okay. All right, so we also have Duff. Duff actually said that he's from Walnut Creek, California, and found out from my husband, John Paul. Yes, John Paul is already a passer for the passer for the NCLEX exam. Very good. And also last week we have Riza, who also passed the NCLEX, NCLEX-PN, and she has a workbook, and she reviewed the through our online academy, watching all of the videos, and she passed with 63 questions in the NCLEX. So very good. Okay, so all right, so let's have okay, so we will now have wow, we have a lot of people tonight. So Freda is from Rosamond, California. I'm really having a hard time trying to you know, catch up with all the comments, but thank you very much, everybody. So now we are so excited, everyone, to have our first question for tonight. Our delegation and prioritization, especially prioritization, will focus on pharmacology as the first question. So now the question is, are you good with pharmacology, everybody? This is prioritization based on pharmacology, all right, as a concept. So let's have the first question, everyone. Okay, so this is the first question, everybody. Okay, so I would like you to imagine that you are sitting right now and about to take your NCLEX examination. So do you think you'll be able to answer this question? And these kinds of questions, in the NCLEX are in the analysis or application level. So meaning that they play a big part on your performance to pass the NCLEX examination. Okay, so let's have the first question, everyone. The nurse has just finished administering morning medications to clients in a medical surgical nursing unit. Which of the following clients require immediate assessment? A, the 25-year-old client who complains of fatigue after receiving propranolol or Inderal. B, the 56-year-old client who reports weakness and cramping ever since taking chlorothiazide or Diureal. C, the 48-year-old client who develops dry cough after taking enalapril or Vasotec. And letter D, the 62-year-old client who experiences headache every time nitroglycerin is taken for chest pain. So let's see your answer for this question, everybody. Okay, so what do you think is the answer to this question? So this is pharmacology, and requires immediate assessment means that you're looking for a patient or a client who may be having a complication related to the use of the medication. So what do you think will be the priority in this question, or the answer in this question? Let's see. Okay, so remember that NCLEX questions are highly reliable and statistically proven. So the questions in the NCLEX are not meant to trick you, but these are questions that have undergone psychometric testing and evaluation. And I know this because that is part of my training and certification as a nurse educator. Okay, and I love making test questions. Okay, so I love making test questions. All of these things that you have here, these questions that you have, I make all of them. Okay, and I really like making questions, and of course it's a skill that you need to have when you're making questions. There are principles that you need to follow when making test questions, making sure that there are no biases in the question, making sure that it's a question that is valid. Okay, so very good. So I have your rational, everyone. So let's see the answer to this question. Let me see. So this is pharmacology, everybody, and you will notice that these are antihypertensive medications. The one that you have here are a class of antihypertensive medications, or medications that actually can cause hypotension. All right, so let's see which one will be the answer to this question. How many percent sure are you with your answer, everyone? Are you 100% sure that most of you answered letter B? Are you sure it's letter B, everybody? You might be surprised of the answers, everyone. Okay, are you sure letter B is the answer, everyone? Okay, so let's see how many percent. Okay, so we have Joe Baldsky said that diuretics can cause the potassium level to go down. Okay, we also have another one, another rationale from one of your classmates here. Okay, all right, let's see. All right, so we have another one. So I have a shout out very quickly. So this person is my very good friend. Okay, she's a clinical nurse specialist and we graduated from the same school. So hi Nirina, I'm giving you a shout out for tonight. So thank you for invading my session for tonight. So I will see you one of these days. Okay, and she's taking her doctorate also right now. So that's a secret. All right, but anyway, so the answer to this question is going to be letter. All right, so the answer to this question is going to be letter, let's see, everybody. Very good. So letter B is the answer, everyone. So congratulations to those who got the right answer to this question. Very good. Okay, so letter B is the answer, everybody. Okay, and why is letter B the answer? The reason why B is the answer is because, number one, your thiazide, your diureal, is a diuretic that is potassium wasting. And aside from that, it also lowers down the level of sodium. Okay, comparing your furosemide and chlorothiazide are actually more capable of causing the patient to develop hyponatremia. So always remember this, that every time you're giving diuretics, you're not only losing potassium, but you're definitely losing sodium, because that's how your diuretics act. They excrete your sodium from the body in order for water to follow. So here you have hypokalemia and at the same time hyponatremia. And the worst case scenario for this patient later on with hyponatremia is going to be convulsions. Okay, so in this situation, letter B is the answer, because your rational is low potassium and at the same time that will be low sodium. So very good. So letter B is the answer. Now letter A here, remember everyone, letter A, fatigue after taking propranolol is actually a common side effect of the medication. So nothing really not really a big concern there right now. Letter C, you have your enalapril or Vasotec, which is an angiotensin converting enzyme inhibitor or ACE inhibitor. And we know that ACE inhibitors cause dry cough, okay, because of their action or mechanism. But dry cough is expected, or it happens when the patient takes an ACE inhibitor, okay? The only time that ACE inhibitors, the side effect of dry cough may be reported is if it worsens or becomes persistent. If it worsens or becomes persistent. So you need to report the dry cough. Okay, so for example, if letter C, the patient, for example, says that I've been having severe cough for 1 week already, so I think we really need to look in that situation. Okay, but letter C, the patient just develops cough after taking enalapril, so meaning that that is a side effect at this time and we need to monitor that. Okay, now letter D, the 82-year-old client who experiences headache, always remember that nitroglycerin, a common side effect is headache. Okay, and the more that the patient takes nitroglycerin later on, the headache becomes less severe. Okay, so it's not really something to be reported. All right, so letter B is the answer for this one. It's really very dangerous because of the electrolyte imbalance. So congratulations for those who got the right answer. Okay, for letter B, you know, and hypokalemia can also cause arrhythmias. All right, okay, so very good. So let's have the next question, everyone. All right, so for the next question, are you ready for this, everybody? This is another pharmacology question. Okay, pharmacology question again, and this is one of the most common skills or question in the NCLEX about medications in the NCLEX. Okay, how to properly take your metered dose inhalers. So let's see how good you are in terms of MDI administration. Okay, so let's have the question. The nurse teaches the client with asthma on how to self-administer metered dose inhaler medications. Which of the following statements of the client requires further teaching? So meaning something is wrong with the patient's statement. Okay? So one of the things that I really want you to learn or to know in the NCLEX is how you approach negative question. This is an example of a negative question. Everyone, can you please take note of this? This is a negative question. When you say negative question, it is a question wherein it's looking for the wrong option, which is the answer. Okay, and usually you will know it's a negative question because it says usually like requires further teaching or warrants further intervention. So in this question, letter A says I should take the steroid inhaler before the bronchodilator. B, I have to make sure that I rinse my mouth after taking the steroid inhaler. C, I should wait about 1 minute in between the puffs. Or D, I have to hold my breath for 10 seconds when taking the drug. So what is the answer to this question, everyone? Okay, so let's see, everybody. All right. Okay, it seems like everybody has the same answer, but I would like to find out why is it that you chose that answer. Okay, so sometimes it's not enough to put your answer, but sometimes you have to know why. What is the reason why you put that answer? Okay, so the answer is going to be letter what? Okay, so the answer is going to be letter, very good, everyone. So that would be letter A. I should take the steroid inhaler before the bronchodilator. Okay, and the reason for this is because you have to administer first your bronchodilator and then the steroid, because the bronchodilator will open the airway and then you can administer the steroid inhaler. Okay, now remember, okay, we have here one person who gave us the exact rationale. So that would be Loretta. So Loretta mentioned about opening the airway first and the steroid. Very good understanding there. Okay. Now, one thing also is that when you take steroid medications, or when the patient takes steroid medications orally through inhaler, it's very important to wash the mouth or rinse the mouth after taking the steroid. And we all know that because steroids can cause fungal infection, okay, in the mouth of your patient. Letter C, waiting 1 minute between puffs is okay. And letter D, holding the breath for 10 seconds, counting 1 to 10 slowly. Okay, slowly. So that's the answer. Now, what is the key point in this question? Always remember that in the NCLEX, you will encounter negative questions. Okay, and if you know it's a negative question because it says requires further teaching and like that, I want you to slow down a little bit, because negative questions are usually harder to answer than your positive questions. Okay, so slow down a little bit, making sure that you're looking for the right answer, which is the wrong item. Okay, so letter A is the answer, everyone. Okay, so very good. Congratulations for the correct answer. Okay, guys, thank you. Now let's have your delegation questions now, everyone. So are you all ready, everybody? Okay, for delegation questions. So every week, most of you have been here, and I've noticed that there's a big improvement in some of the people who joins the program. It's almost like, let's see, what's your score for tonight? Who gets 4 out of 4? I want to find out. Okay, so let's see who gets 4 out of 4 every week. Okay, who's perfect? Okay, so let's have another question. This will be your delegation question, everyone, and this is your favorite. It's a select all that apply question. Okay, so let's see. So in the NCLEX, don't think that questions are always difficult. Okay, in the NCLEX, some questions could be just really direct to the point, especially if you're just starting the examination. Okay, it gets harder and harder and harder as you answer more questions. Okay, all right. So the nurse is teaching a group of unlicensed assistive personnel on pressure injury prevention. Which of the following items are tasks that can be delegated to the UAP? Select all that apply. A. Reposition a client every 2 hours. B. Report any signs of skin breakdown. C. Press any red area to check for skin blanching. D. Apply moisturizing lotion on the client's skin after showers. E. Place the client on the chair for brief periods during the day. Alright, so this is select all that apply question, everyone. Pressure injury prevention. So which of the following items are tasks that can be delegated to the UAP? So what do you think is the answer, everybody? Okay, reposition a client every 2 hours. Report any signs of skin breakdown. Press any red area to check for skin blanching. D. Apply moisturizing lotion on the client's skin after showers. And E. Place the client on the chair for brief periods during the day. So let's see. Okay, it seems like everybody's getting the right answer. Some people miss some answers actually. Okay, so this could be a learning opportunity for some other people who may have the wrong answer for tonight. Okay, so always remember this. Okay, so all right, so we have all of the answers. I think they're still coming in. Always remember the 3-letter S's. Okay, that would be scope of practice of the UAP, stable patient, and a simple routine only. And the RN should never delegate EAT, evaluation, assessment, and teaching. Remember that. RNs should not delegate evaluation, assessment, and teaching. Okay, so let's have the answer, everyone. Okay, very good. So let's see. All right, so the answer to this question, everyone, will be letter. This is a little bit exciting because we have some people with different answers. The answer is going to be correct. That would be A, B, and D, everyone. Very good. So A, B, and D. And why is it A, B, and D? All right. Repositioning a client every 2 hours is really the responsibility of the UAP. And letter A, it is a stable patient. There is no indication or any description or clinical description that letter A is an unstable patient. Okay, so A is not an unstable patient. So A is okay. Letter B, report any signs of skin breakdown. Of course, that is the responsibility of the UAP. C, press any red area to check for skin blanching. Unfortunately, letter C should be done by a licensed nurse, okay? Especially your registered nurse, okay? Because that is an assessment to find out if it's really a stage 1 pressure injury, okay? And by the way, everybody, I would like to let you know that the new terminology for pressure sore or bed sore, it is now called pressure injury. Again, the new terminology for pressure sore or bed sore is now pressure injury. Okay. Letter D, can UAPs apply moisturizing lotion? Yes, of course. Moisturizing lotion is within the scope of practice. Unless it is a prescribed medicated cream, then we cannot delegate that to the UAP if it is a medicated cream or prescription. All right. D, place the client on the chair during the day. Okay, the answer is D. or letter E is included because place the client on the chair during the day because that's a responsibility of the UAP. Okay. For letter D, it's only a moisturizing lotion. Okay, to prevent skin breakdown. It doesn't say anything that it is a medicated prescription cream that should be applied on the client's skin. All right, and UAPs can actually definitely apply creams. All right, or lotion. All right. So we have that as the answer, and most people actually answered A, B, and D, and what? And E. All right. So let's have now the last question for tonight, everyone. Okay. All right. So again, do not presume that when you say a lotion, it is a medication, you know, so avoid adding more into the question or adding more into the item. All right, because it doesn't say anything that that medication or lotion is medicated or prescribed. Okay, unless it is an antifungal medication, unless it is a hydrocortisone cream probably, and it is a prescription medication that needs to be signed off by a licensed nurse on the medication administration record, then it has to be given by a licensed nurse. Okay, especially if it has to be signed off by the RN or the LVN. Okay, so let's have your last question for tonight, everybody. Okay, and then we will announce the winner of our 90-day online NCLEX review for this week. So we will find out before we end for tonight. So this is the last question for tonight, everyone. So this is your delegation question again. The nurse works together with an experienced and licensed assistive personnel, or UAP, in caring for a client who underwent open cholecystectomy 24 hours ago. Which of the following tasks should not be delegated? So again, this is a negative question, everyone. This is a negative question. Okay? Negative question. So A, obtain vital signs during the shift. B, empty the Jackson-Pratt drain. C, explain the purpose of the incentives parameter. Or D, give the client ice chips as ordered. Okay, so make sure that you know the answer to this question. Okay, the nurse works together with a UAP after a cholecystectomy 24 hours ago, okay, of a client. So what task should not be delegated? Obtain vital signs during the shift, empty the Jackson-Pratt drain, explain the purpose of the incentives parameter, or D, give the client ice chips as ordered. All right, can you please give the rationale again? This may be a very simple question, but hopefully you're getting really, you know, delegation questions seem to be a little bit easy for you now, guys. We will have more challenging questions in the next few weeks for you. Okay, so let's see. All right, so everybody, can you type on the comment section what is the meaning of 3 S's again for the UAP? What do you mean by 3 S's, everyone? That's always been our acronym for the UAP. All right, always remember, UAP can ambulate patients, but if the patient is unstable, recently had immediate or recently had hip surgery, for example, then they cannot ambulate. Okay, so always remember, it has to be within the scope of practice, stable patient, and then also a simple routine that does not require complex critical nursing judgment. Okay, so the answer for this question is going to be letter. Very good, everybody. So that would be letter C. Explain the purpose of the incentives parameter. So teaching is not the responsibility of the UAP, especially if there's something to do with immediately after surgery, okay, or the first time the person is going to use or the client is going to use a device. So explaining the purpose of incentives parameter, explaining the benefits or purpose of deep breathing and coughing, explaining the benefits of splinting the incision. So you always have to choose the option that is the most simple routine for the UAP. So in the NCLEX, you might be confused sometimes, but always remember this. Always go for the most simple option. All right? That's your guiding principle when you're answering questions in the NCLEX about delegation to the UAP. Because one reality that you have to understand is this. The UAP scope of practice varies in every state. Every state has their own scope of practice. So when you answer in the NCLEX, okay, always remember that you choose the simplest and safest nursing or task for the UAP. Okay, anything that will not endanger patient safety, anything that is not requiring complex critical thinking or nursing judgment. Okay, and UAP can include your medical assistants in other states, orderlies, for example, certified nursing assistants as well. Okay, and they have different or varying scope of practice. So always choose the simplest routine or simplest activity or task for the UAP. Okay, so thank you very much everyone for that. Okay, so we have some people mentioned actually here tonight. They mentioned about the three essays. So we have Emma Domingo Guerrero. So Emma actually I think is one of our students. So scope of practice, simple tasks, and stable patient. Okay, stable patient. Very good. Okay, so I hope that you will remember that when you're taking the NCLEX. Okay, all right. So can the UAP encourage the use of the incentives parameter? Well, as long as the UAP is not teaching the patient, okay, especially for the first time, of course the UAP can remind the patient to use the incentives parameter. Okay, can remind, but not definitely teaching the patient on how to use the incentives parameter. Okay, and it also depends on the situation. You know, the how recent is the surgery. Okay, so remember that, and also you have to look at the other options as well. Okay, so make sure that you have to choose the option wherein 100% you're sure that this is always being done by the UAP. Okay, so encourage the patient to use. All right, so just a reminder, probably you can do that. Okay, but not really teaching definitely. All right. Okay, and always remember this, that there are different sources as well and opinions regarding the functions of the UAP. So sometimes you can see some discrepancies, and that's why my guiding principle with all of you guys when you answer in the NCLEX is always look at all of the options, okay, and always choose for the most simple task for the UAP. Okay, so you have to weigh in all of the options A, B, C, and D. All right, so before we end for tonight, I would just like again to shout out a little bit on our programs in Matus Nursing Review Online NCLEX Academy. Okay, so here our program in the Matus Nursing Review Online NCLEX Academy, we have the live webinars ongoing right now, and then we also have the self-study online NCLEX review with our workbook. So far, most of our students really like the workbook. And for the 10-day program that we have, the every Saturday class that we have another batch starting in October 10 to December 19. So our every Saturday class, the comprehensive review, and every Tuesday we have our fast track review from 7 to 10:30 p.m., which we may also change probably to 6 to 9 p.m. Every Tuesday. So we have an every Tuesday class, and we have a Saturday class ongoing as well. So if you need more information, visit our website at www.matusnursingreviewacademy.com, or you can also send us a message. Okay, and at this time we have a 10% discount promo for this month. So if you want to avail of the discount, which is big, which is 10%, then avail that as soon as possible before the discount is over. Okay, so we do have highly organized and up-to-date test plan-based curriculum. You have the NCLEX Success Workbook. We send out for US residents, we send out my book, the eBook Kindle version. Okay, and we have hundreds of critical thinking NCLEX quizzes in the Academy. So we have hundreds of end of lessons NCLEX quizzes. And if you want more Q banks, then you can have the UWorld option as well. UWorld NCLEX. Okay. All right. So now we also have, everybody knows as well that I have a book that is published in Amazon and Barnes & Noble, and this is now available in the Philippines, and it's in Amazon, and it has 5-star rating, and I think some of you in this group actually have the book. And can you please tell me in the comment section what is one thing that you like about my book, everyone? Okay, can you please tell me what is it that you like about my book? Okay, because it has a 5-star review, and if you want to buy in the Philippines, just send an email to matusnursingreviewacademy@gmail.com. Okay, so thank you, very helpful. Okay, Maninder Kaur, thank you for being here tonight. Thank you, thank you. The book actually in Amazon is $54.50. I'm gonna put the link on the comment section later on. Okay, so everyone, are you ready to know the winner for last week? Okay, so Menchi said the book is concise and precise. Okay, so you want to find out the winner for last week's, okay, Facebook Live. So let's see who will be, okay, who will be winning for tonight. So let's see. So we have Droll. Sir, your book is complete and concise. Yes. Okay. Very good. Thank you. Yeah, I think you messaged me and you bought my book. Thank you very much. A lot of good comments here. Straightforward content and organized. Very good. Okay. So we have book is very organized. Thank you, Pratikshya. Okay. All right. So we do have some questions here in the comment section. You can also send me a private message. All right. And then I will answer your question, everyone. All right. So the winner for last week, which is the winner tonight, is going to be. All right. So we have the name. Are you excited, everyone? Okay. So drum rolling. Okay. So we have Kate De La Torre. So Kate De La Torre is our winner for tonight. Okay, congratulations. So congratulations. That would be Kate De La Torre. So you won the 90-day online NCLEX, okay, access. Okay, 90 days, and we will enroll you. So please send us an email as soon as possible to claim your prize, and you can also transfer this to another person if you want. Okay, and again tonight, everybody, thank you very much. And without you guys, I'm not gonna be here. And again, always remember that there's a lot of things to learn in order to pass the NCLEX, but I always tell the students that you cannot be a walking encyclopedia when you take the NCLEX. However, you need to know the most basic concepts that new graduates should know. Okay, and my goal, and even the academy, a lot of students have given a feedback, it's simple, fast, and easy to understand. And that is my goal on how to simplify the concepts, because you may be answering thousands of questions, but if you don't understand the concepts, or you have gaps in your concepts, then you will still not be able to pass the NCLEX. So you need a comprehensive review and a direct to the point review, and you can see all the testimonials. But anyway, I'm very happy that you're here, everybody. Okay, so in the service of nursing students, thank you very much. So congratulations to Kate De La Torre for winning tonight. Okay, and again, everybody, thank you very much, and have a good night. I'll see you again next week.